Now I want to start to dig into the M.A.R.C.H. Now that you've seen what's in this kit, we're going to go ahead and dig into M, which is massive bleeding. All right, so here's a little introduction to massive bleeding. Of course, we're going to talk about tourniquets, then we're going to talk about packing a wound. Now, these are things that if it's on an extremity or something like that, that you need to stop the bleeding on, that's where these are going to come in. Now, where the packing and stuff is going to come in, if it's somewhere you can't stop the bleeding. So here, if you've got an artery that's cut or severed here, you can stop the bleeding with a tourniquet here. But what if it's under your armpit or it's in your waist or something? Obviously, you can't put a tourniquet around the whole body, so that's where you're going to get into packing the wound. In the M for M.A.R.C.H, these are the two things you got to know how to do. These are things that are life-threatening in minutes. Most of the stuff that's just sitting in the planes or on the outside of my kits, those are pretty much cat tourniquets that kind of look like these. And let me open this one up so you can see what the cat tourniquet's like. So here's a typical cat tourniquet. This is where you're going to put it onto somebody's arm. We're going to show you that in a second here. You got your tail, that I call it. You got your C-clamp. Here's your windlass. So once you get it on, you tighten it. Then your tail's going to come around, go through here. And that's what a cat tourniquet looks like. Now this one is a newer one that I always keep in my pocket. And this one is from Snake Staff Systems. Why I have this one always on me in my pocket, again, these are like on my med kits or on my EDC. This one I have with me all the time. And the reason is because this one is small enough for your dog, for kids. These are too big for a small child. If you've got a small child, there's no way you can cinch down on these enough. If you've got a canine like we do, Dom, go check out our video on Dom. He's our German Shepherd. If he's on the range with us or something and there's an accident, this is small enough where it'll get small enough down for even a dog's leg. So Snake Staff is a great tourniquet that I keep on my body all the time. Now, if I'm on the range and I got a range belt on, of course, I'm going to have one of these attached to my hip as well. All right, so let's talk about how to use them and some other things you need to know. Now, there's one myth I want to get out there right now. People say, oh, once you put a tourniquet on somebody's limb, they're going to lose that limb for sure. It's going to go. That is not true at all. The only time that's true is if it happens to be on somebody for 6, 8, 10, 12 hours, it depends on the circumstances. If it's only going to be on there for an hour or two and you're getting them to a hospital or something, they're not going to lose their limb because of that. Just keep that in mind and go watch our full courses when it comes to tourniquets. Okay, so let's talk about how to actually put on a tourniquet and how to use it. Again, it's the M in M.A.R.C.H. You're going to have your tourniquet like this and you're going to keep it through the buckle and you're going to put it on somebody over the clothes. Don't worry about the clothes. You might have maybe 3 minutes if they're really bleeding out. So you want to get that up on as high as you possibly can above the joint. Remember, if the bleed out is down below here, you want above the joint and as high as you can go on the joint. Once you get it on, you're going to pull it as tight as you possibly can with the strap before you use the windlass. You're going to get all the slack out of it, pull it really hard, and then you're going to get the Velcro all the way around. And then once you get it around there solid, that's when you're going to go to the windlass. And this is the little windlass with some connectings here that then as you're turning it, it's going to really tighten up on the tourniquet. Keep going until the bleeding stops. Once that bleeding stops, you're going to go ahead then and secure the tail. You don't want to just leave the tail sitting like this because it's like a rip off. If you're carrying somebody, it could rip off and you do not want this to come off once they get this tourniquet on there. Put this strap through the C-clamp with the windlass and then you're going to put this strap over the top of the C-clamp, just like that. Okay, so now everything is secured. And then you can go ahead and put the time on here. Now I'll tell you that I'm in that situation. I also kind of wrap the arm with the compression bandage. It's a little overkill, but I do. I wrap it around, and if somebody's in a situation where it's pain and all that kind of stuff, I'll also secure their arm to their body, know the bleeding stopped, and get them stabilized. And then from that standpoint, we'll get them moved to the hospital. That's how you put a cat tourniquet on. Now, it works pretty much the same way for the smaller Snake Staff one that I talked about. Same thing, even if it's a baby or whatever, have somebody assist you to hold the child or a dog, whatever it may be, to get this one on there. These are going to be tough on a child. So those are the cat tourniquets. That's how you use these particular tourniquets. Now, just a quick note again, if they're not screaming that hurts like hell, or the bleeding hasn't stopped, you're seeing blood, then you didn't do it right. Now, if that's the case right away, redo it and make sure you get that bleeding stopped, okay? Let's move on to what I call the rapid, or they call the rapid tourniquet. Now, the rapid tourniquet's a little different. This one is like stretchy, And you can kind of see it here, and we're going to show you at the same time. And basically what you're going to do with the rapid tourniquet is the same type of scenario. You're going to put the strap through the hole, and then this is where the arm's going to go through. Just like this, same scenario. Above the joint, wherever the bleeding is. Going to pull this really, really tight, and then you're going to want to wrap this at least 3 or 4 times around that arm. Now, you want to layer it, but not layer it on top of each other. You don't want it on top of each other. You want it layered below like this. So every time you go around, you want to see it layered just like this going below. Then once you get that done, you're going to come up and put it right inside the clamp here. So you're going to clamp it, and it's all, now remember, bleeding's got to be stopped. So you want to do that. The first pull is where you're going to be getting the bleeding to stop. Then you're going to come around as tight as you possibly can, as many times, come back in the clamp. Same thing. I will stabilize the patient with some pressure bandage or elastic bandage just to get them stabilized so they don't move it and things. That's really it on tourniquets, at least the minimum that you really should know. Whether you're flying or on the range or you're out camping, I always keep these outside of your med kit. You don't want to have to open up your kit and go find this tourniquet that was inside the med kit there. This is always on the outside, or it's always in my pocket. This is one of those mission critical things that somebody can bleed out in 3 minutes, can die. So this is something you got to do really quick, get it on there, stop the bleeding as fast as you can. So let's talk about packing a wound. So first of all, in this kit, and you should always have at a minimum these things here. One is your gauze, and you know, your typical gauze is going to be like a roll. One trick is you want to not open it from the outside, but you want to pull from the middle of the gauze and then use that, pull it out and go around a wound. That way there, if you drop it or something, it doesn't just kind of roll out. Then you got the compression gauze, and again, same thing, except this is compressed and it's in like a Z format. Those are good to have. Now, quick clot is really important. This is a hemostatic dressing. What that means is there's infused into this dressing materials that will cauterize or clot, is a better word, a particular bleed or something. So if you can get into an artery or something that might be in the arm, you got an artery, maybe a gunshot wound or something, you want to get down into that, you want to use this. And we're going to show you how to use it in a second, but basically you're going to create a really small ball in the end, push that ball in, feel where that bleeding is. You can usually feel it. We're going to show you how to do it, but you're going to keep pushing this down in there and pack it. That's why we say packing that wound. Pack this all the way in there. There's a little bit on the top there we'll talk about. You're going to wrap it with the gauze, get that wrapped, and then you're going to come back, and this is kind of like the final dressing, and it's a pressure bandage. And you're going to see here in a second when you open it up, there's a spot that's like sterile, that's the spot you're going to want to put on top of that packing and then wrap the arm. Again, if I'm in a situation like that, somebody has a gunshot wound or some kind of, they're bleeding out here, I'll also, no matter what, if it's in any of the extremity, I'll try to stabilize this with dressing after that and keep them stable. One extra thing I want to talk about the emergency pressure bandages is you're going to see there's a spot on here where it says other side towards the wound. That's where you want to put that, right over wherever that wound is. Now, the other nice thing about the M.A.R.C.H products is you'll see there's a little bit of a Velcro strip that goes along with this. If you were to wrapping somebody and you drop it, it doesn't roll out, it stays stiff, or it stays connected as you wrap all the way around that wound. So let us show you how to use this. We have an example of a bone-eye leg with skin on it, and we're simulating a ballistic wound here. So you can see that you got the fake blood going up through it. It's going up into where the artery is, and that's going to be considered your artery. Now keep in mind, if somebody's bleeding out in an artery like this, you have minutes to get that bleeding stopped. That's critical that you get onto this right away. That's why I also say when it comes to M.A.R.C.H, know these things inside and out and how to use them, because you don't want to be searching around and trying to look at a manual on how to use this stuff. So the first thing you're going to do in a bleeder like this is you're going to get out your quick clot. This is the hemostatic dressing in here, so it has the agent that'll stop the bleeding. Now you want to take the end of this gauze, or I should say on this hemostatic dressing, and create a little ball, you know, a nice little tight ball. You want to get that started first and then hold the other side of it in your hand. So do whatever you got to do to find where that bleeding is. Get the blood out of the way, move it, you know, whatever it is, get that out until you can see it. If you can't see it, get your finger in there, feel around until you can kind of feel where the blood's coming out of. Then you're going to take the end, the power ball, you're going to get that right down into where that artery is bleeding. Get it all the way right down in there, not on top, not around. You want to get it right in there, nice and tight of where that artery is. Now, if you do it right, the bleeding should stop. You should see that bleeding stop right away. That's the first step. If it hasn't stopped, you haven't found it. You've got to find that spot, get the hemostatic dressing on there, and then get that bleeding to stop. Hold that pressure on there. Okay, now here's the point where once you get that stopped and the pressure is on there, never let that pressure off. You're going to have the other end of the hemostatic dressing in your hand, and now you're going to use both hands. So with that pressure on there, you're going to take a whole bunch of more of that dressing, push that back in on top of that finger. Pull that finger out, do the same thing. Put the next finger on, keep the pressure on constantly, and keep packing. Pack that hemostatic gauze in there all the time. Never let the pressure off. As long as it's not bleeding, then you know you've got it. Don't take the pressure off it. You can hold the gauze in between two fingers and roll it out as you're actually applying and packing that wound. Now you're going to keep packing until that entire hole, that void, is filled with the gauze. Now if it's a small one, you might have a little bit left over, no problem. But you want that all packed inside that wound hole. Now it may be that you use the whole thing that you get into that wound. That's okay, use it all. You want that whole thing in there because remember, the quick clot is a hemostatic dressing. So it has material in there to help clot that. Then after that, you can move to the other gauzes that actually continue to fill that void. Now what's going to probably happen in most cases is after you're continuing to fill that void with the regular gauze, you keep going until it actually comes out and you might have a lump on top of it. Now the pressure's still there, you're keeping that pressure on, now you've got a little bit. Now you can either cut the gauze off, which you really don't have to do. It's nice to keep that whole clump there because you want to keep that pressure on it. And then when you come in with the next one, which is your pressure bandage, you want that pressure. So even if there's a little amount of gauze on the top there, that's a good thing because then that'll help with the pressure when you put the pressure bandage on. Don't worry about that, get that on there. Now a quick note, hemostatic, it should start working and you should stop the bleeding in about 3 minutes. Now, if you don't have hemostatic and you're just using gauze, you're gonna have to hold that probably for at least 5 minutes for that to stop. Hopefully you have quick, you always should have one of these, especially if it's a big artery that's bleeding. You wanna get that stopped as soon as possible. Then once you got that, you wanna continue to hold the pressure on there and then have your emergency bandage ready. Hopefully you have these open first, have these sitting there ready for you. And then you go ahead, like we already talked about, get that pressure bandage on there. Now, a couple quick notes. You went through all those steps, and then you start to see blood, red that's coming through these. If you got red coming through here, you didn't do this right. That's a problem. Hopefully you've got multiple of these. That's why it's good to have multiple of these, because if that's the case, you need to start over. You got to get back in there. You got to start, number one, this is a critical chain, critical path. You've got to get that first bleeding to stop with this. Get it in there, get it tight. If the bleeding stopped, great, continue on, do it again. And then like I said, the last thing I do, like why I have these is I'll also give that little extra pressure on top of that and keeps that area clean, mobilizes that person, secures them. Okay, so we covered the M in March. Probably the two things when it comes to bleeding, like hemorrhaging, that you need to know. These are at a minimum. Whoever you are, whatever you're doing, flying planes, shooting guns, hiking up in the mountains, you need to know these two things. Tourniquets and pressure wounds. So the A in M.A.R.C.H is airway. You've got to make sure those airways are clear, that people can breathe. And we're going to talk about the nasal pharyngeal tool. Now this tool enables us to get past through the nasal passages, get past the tongue for somebody so that they can be breathing. You're typically not going to be doing this for somebody that's conscious. It's usually somebody that's unconscious. We've seen stuff where maybe even somebody gets a little drunk and they fall on their back and their tongue is down their throat or something, or somebody that might have like an allergic reaction to something and their tongue is all swollen. And you're going to typically know if it's usually somebody that's unconscious, and you're going to know because you're going to hear them either sound like they're snoring, or if you just take your tongue right now, put it on the back of your throat and try to. That's kind of the noise you're going to hear. That sounds like somebody's struggling to breathe. Okay, if you can't clear their throat or whatever, and they're on their back or in a situation that you can't get them to breathe again, this is where you would use this tool. So when do you not use this tool? Well, one is we just mentioned. If they're conscious, you're most likely not going to use this tool because that is just, it doesn't feel great. And you'll see that in a second here. The second thing is this is not for choking. You know, if somebody's choking or something on something, you have to deal with it in all of our other lessons where we talk about how to deal with choking. This is really for trauma patients where you can't keep their airway open. Because remember, these 5 things are like the mission critical. Bleeding, airway, they got to be able to breathe. There's a couple things in this kit. One is the NPA, and then there's also lubricant. So you want to lubricate this about a 1/2 inch below the bezel, all the way down to the end. And then keep your fingers dry though when you're putting it on so you can grip it and you can manipulate it to get it into the nasal passage. So you're going to have your gloves on, open up the package with the lube on it, and while it's there, so don't put it on your finger and put it on the NPR. You want to keep it in the package and just run it over the NPR and keep your hands clean. So how do you insert the NPR? I mean, basically what you're going to do is hold their nose up so they almost look like they got a pig nose. So you're going to hold the nose up. You're going to put it in the right nostril. You're going to insert it all the way down with the lube on it, all the way down until the flange hits the nose, as you can see here. Now, as soon as you have it all in, you want to check. Does it seem like they're breathing now? Does it seem like it cleared it up? If it is, you're going to tape that down. Get your tape that comes in your kit here. You're going to take this tape, you're going to tape it down on their nose. Now you've dealt with the breathing issue. As you can see here on the model that you've got the nasal passage that goes down to the back of the tongue and then into the throat. Which happens is if somebody gets unconscious or they're swallowing, the back of the tongue will close off that airway. So this will bypass the whole thing. You're basically pushing it down and pushing the tongue out of the way to get it down into the throat area to clear that whole nasal passage and the back of the throat up. Okay, so now let's go on to R, which is respiration, M.A.R., respiration. And that's where the chest seals come in. I know we talked about it a little bit here already. Why do you want multiple chest seals? Well, we talked about it, especially if you're in E3 Firearms or you're on the firearms side or even in other areas where you might have a puncture that goes all the way through. There's typically an entry wound and then an exit wound. So if you see an entry wound, you got to check 360 degrees all around this box and find the exit wound. So typically where your chest seals are going to work are somewhere between here, the waist, all the way up into here. This is like the box. So you want to check the box area and make sure if you find an entry wound here, that's where you're going to start with the chest seal, and then you'll have the exit wound there. You don't want air. If somebody's trying to breathe, you don't want air filling this cavity. You might think, well, if it's only one lung, well, they can breathe with the other lung. Yeah, but that's not the issue. The issue is you're creating pressure inside there of your heart, cardiovascular type pressure that's happening inside there. That's what's going to kill you, not the fact that you can breathe or not breathe off of one lung if one lung is collapsed. The more that's going on, the more you're breathing, the more air is filling that cavity and putting all that pressure on those other organs. You've got to stop that as soon as possible. The chest seals, how these work is they're kind of like a check valve. So if you know, we do check valves in our RVs and stuff when it comes to water coming into our coach, or we have check valves in the fuel lines so that it can't go backwards in it. It's the same kind of thing. So how these chest seals work is you've got a very, very sticky membrane on the outside here. In the middle, you've got a seal, but then there's 4 little holes on the outside. So what does that do? It's when you breathe in, the seal closes, doesn't allow air in, but then it allows the pressure out. So the pressure can come out of the cavity, but it won't go back into the cavity. That's how a chest seal works. Okay, so let's talk about how do you apply a chest seal. So if you identify that there is a gun wound or some kind of wound in somebody's box here, and you see that and you know there's air going in there, well, the first thing you're going to do is you want to hold something over that. You want to stop the air from going into that wound. Now, you don't want to put your hand down on that wound. You want to put your hand on the back side of your hand and push on that hole or that wound. The reason is because then you can continue to use your hand while it's on there to manipulate the chest seal, because you're going to have to hold the chest seal, pull that very, very sticky chest seal off, and then as soon as you do that, you're going to move your hand and get that chest seal, the center of it, right over the hole. Pack it down good. Make sure that there's all that stickiness all around there. Of course, the first thing you want to do is you're going to use your cleaning kits and stuff here, alcohol, whatever you've got. Clean that area so it's not sticky. Sweat, whatever is there. Clean that whole area. Get all the blood out of there and everything. Hold that area where the wound is, the back of your hand. Pull the seal across. Get that chest seal on there. As soon as you've done that and you see that that's stopped, you want to go find the exit wound. Do the same exact thing on the exit wound. Get that seal on there. Okay, so we did M.A.R. Now we're going to do the C and the H. C, circulation. So why are we doing this before H, which is hypothermia? Hypothermia at the very end, you'll see in a minute that you have to have everything done before you get to the hypothermia or keeping somebody warm. So the C for circulation is, we've already dealt with M.A.R., like all the mission critical, the death-threatening types of injuries that somebody may have. We got those stabilized, and that's the first thing we're going to do, stabilize the patient. So we got them stabilized. Now we're going to go on and check now the whole body for other things, circulation, maybe a little of the bleeding, maybe it's not arterial bleeding, maybe it's internal bleeding, but it's not arterial. You might need some pressure bandages or something of that sort, or if there's any other little bleeding or stuff, you can deal with that. Maybe there's another cut or something that's bleeding a little much. You got enough here that you can do to dress that up. Again, it's not arterial, but they're still bleeding. So you deal with that stuff and get that done, that circulation stuff out of the way. Why? Because when we get the hypothermia and we kind of wrap them up, you can't check them again. They're kind of there, they're done. We've done all that. We've done the C in M.A.R.C.H, all of circulation stuff. Now let's move on to the H, which is hypothermia. So like we talked about already, it doesn't have to be cold out for a patient to get into hypothermic conditions. They're losing a lot of blood. It can be 90 degrees out and they can get hypothermia. You always want to keep their temperature up when they're in this kind of situation, a trauma type situation. The other thing that we can use is what we call the space blanket. Now this space blanket, they're pretty incredible. I mean, they're like crinkly, and you're going to open them up and you're going to cover the patient. So if you ever used one of these space blankets, you'll know that it really keeps you warm. It reflects your heat back to the body. The key thing in using these is you want to make sure it gets wrapped all the way around the patient. Specifically, you definitely want to get the torso covered and in the head. So if you do that, if you need to use two, go ahead, use two. But you definitely want to get it wrapped around the head, get it all the way down the backside and all the way around the body. And look, that's really it when it comes to hypothermia. It's not really overcomplicated. But a key thing to remember is once somebody gets into hypothermic conditions, it's really hard out in the field to get them back out of that. So you want to try to stop them from getting hypothermia right as soon as you possibly can. Okay, everybody, so when it comes to this kit here, now you know all the basic fundamentals. M.A.R.C.H, you know how to put on a tourniquet, you know how to pack wounds and stop bleeding, you know how to deal with the airway, you know how to use an NPR, you know how to use chest seals, how to deal with circulation and hypothermia, M.A.R.C.H. Those are the critical things. If you at least know those and you're proficient in those are like the things that are definitely going to be life-saving. We're going to go through the EDC kit, the smaller one, and just talk about the little bit of differences that are in that as well. And like I said, if you want to get the full course on all this, the advanced stuff, log into your E3 membership. There's hours and hours and hours of all the stuff we talked about and then some, from legal considerations to broken bones and advanced stuff on how to clear people's airways. And they're all tailored to whether you're a pilot in aviation, whether it's firearms, or you're out in the wilderness, overlanding or off-roading. Make sure you check that out. So let's pull out the other kit and just kind of talk for a few minutes about the differences in that versus this huge M.A.R.C.H large kit. All right, so guys, I promised I would go through my little EDC. Again, this thing is just a little tiny one, goes with me wherever I go, cars, no matter where. This is a totally different video. You can go check it out because we get into stuff like flashlights and all kinds of other stuff that's in here. Power packs, cables, batteries. This EDC is a totally different video. Now remember, we always keep our tourniquet right here on the outside. Remember I talked about you always want to have that tourniquet where you can quick and get to it, so that's always on the outside. But I'm going to spend a second and just talk about, from an EDC standpoint, what's in my little kit that this is the carry one that goes with me. Now first of all, got chest seals sitting right here, ready to go as fast as I can. I've got some cold pack, got some medication. In this medication pack, there's stuff in here that's a little bit more than what you're going to typically get in this kit where, you might be getting ibuprofen. This actually has stuff where it gets a little bit higher in pain relief. So of course I got ibuprofen and all kinds of stuff in there as well. But then it actually gets into antihistamines and all kinds of stuff. Some stuff that's like a oxycodone level, but I also have my prescription in here with it. But this is just for me. I don't give this to somebody else. And they're in here in order of pain. You got ibuprofen, and then it gets a little bit more strength as you kind of go down. That's a little separate one I keep in my EDC here. And there's a whole bunch of other stuff, bug spray and stuff in here. But I want to talk about the small med kit that goes with me everywhere. Obviously, it's not as big as this one, but I always have these in like the truck, in the airplanes, cars, because I always have one of these big ones available. But if I'm carrying, I'm going somewhere and I'm hiking or something, this goes with me. This is a mini version that handles what we talked about, M.A.R.C.H. It doesn't have 5 of these in there. It doesn't have 4 of these in there, but it's very specific. Like I got blister mods in here, some ointments and stuff like for bug bites. I got some eye wash. And then of course I have the stuff to deal with tourniquet. So we talk about the M. I have everything that I need in here to dress a wound with hemostatic. So I got a little hemostatic in there. I got the bandages in here. I got the zippy pack where if somebody's got a cut, basically seal up that cut and glue it. Band-aids. And then in here I have one of the glucose, gloves, glue, blister, hydration mod. So as you can see, this is a little bit smaller and a little bit more focused on what I need this to do, to just be this little pack to kind of go off a little day or something like that. That's how this little one is set up. And again, I have tape, Sharpie in here. This is kind of the little one that goes in my everyday carries. Okay, E3 Firearms and firearms enthusiasts, hopefully that helped, as someone that's into firearms, you're out in the range or you're out hunting or something like that. These are critical things that you've got to know. M.A.R.C.H. M.A.R.C.H is something you've got to know and be able to deal with. Key for firearms though is I always have a tourniquet on me somewhere if I'm out with a firearm or I'm out with people, because usually if something like that happens, you might not have time to go run back to the truck if you're out hunting. You know, even if you walk to a range or something, it's a little bit of a walk. You may not have time to go all the way to the truck, find your tourniquet and get it back out. If I'm dealing with firearms, this is on me all the time, and I typically have another one on my battle belt, so to speak. There's another tourniquet there, because if I have an issue right now here, I got to be able to get that off of me and deal with it, especially if I'm alone. I got to be able to deal with that by myself. Go try putting these tourniquets on yourself. Make believe you have an issue in your hand or arm or something, and go put this on your arm, go put this on your leg, try to do it one-handed, and learn how to use this tourniquet, because this will absolutely save your life, especially in the firearms world. These things have got to be there. Then you've got your massive bleeding, packing a wound and stuff like that. Cest seal. Like for firearms guys, those are ones you got to know. Cest seal for sure, tourniquet for sure. Learn how to use those, get them out, play it, rip one open, and figure out how to do it. It's worth $10 to rip one open and see how you use it. Check those out. Everybody in E3 Firearms, thanks for being here, and we will see you guys on the next one.